The Ghana Medical Association has begun a strike that might lead to mass resignation of doctors from the public service across the country. Now, this follows a meeting held Wednesday over the absence of condition of service for doctors and other health workers. After almost 4 hours of negotiation, the representatives of the Ghana Medical Association came out announcing there were issues unresolved in the proposal they submitted to government for their conditions of service. The doctors say for several years they have worked without any single document that determines their welfare. Apart from a 2-week mortuary fees a doctor is entitled to when he or she dies, the doctor says there's nothing to indicate how they will be treated if they get sick or a family member gets sick. Now, the doctors say they pay for their own medical expenses and that of their families, a situation they say must end. After the June deadline was postponed, the doctors met at the General Council and agreed on a roadmap to follow if government were to default on the promise to complete, sign and deliver a document that will serve as conditions of service for doctors. Now, Dr. Frank Srebo said they have begun their strike and will follow the roadmap. According to that roadmap, doctors will begin with the withdrawal of OPD services for a week. If after a week their conditions are not resolved, they will withdraw emergency services and they will later resign en masse. The association instead reviewed the deadline for the strike action from June the 28th of this year to July 28th this year. The Ghana Medical Association called an emergency meeting to review the agreement of the association to embark on a strike action 6 months ago based on the deadline set by the government to settle their service condition. Based on the resolution reached by the doctors, if government is unable to come up with a condition of service for negotiation to start and finally document signed, the association would withdraw their services first from the OPD and then graduate to emergency and then to full withdrawal of service. Now, Dr. Justice Yankson, Deputy General Secretary of the Ghana Medical Association, speaking to the media after the consultation, said the emergency meeting was called to deliberate on a resolution that was adopted at its last annual general meeting. Dr. Yankson, however, pointed out that the failure for government to meet the new deadline will trigger a national strike action. Now, earlier on this year, medical doctors in the country warned of more strikes this year to protest unresolved pensions, market premium and salary adjustment grievances. The Ghana Medical Association says these unmet demands were the cause of their strikes in the year 2014, hence its members will not hesitate to lay down their tools this year too. Now, Ghana Medical Association blames government for being unresponsive to their grievances since 2006. Now, Dr. Opoku Edusei says even if doctors are forced to be in the consulting room when their demands are not met, quality of healthcare delivery may be affected. Now, doctors have suspended their strike pending outcome of negotiations with the National Labour Commission and the Fair Wages and Salaries Commission. Now, Breaking News GH would want to know your comment and opinion about the doctors on strike. What do you think? This week they are taking up on the OPD services. The following week it will be at the emergency, and in the third week, if their grievances are not met, they are resigning. Well, don't forget to subscribe to our YouTube channel Breaking News GH for more news as and when it comes, and don't forget to send us your comments.